Good afternoon, everyone. I'm Boranbaeva Kуралай Borashkızı, English language teacher at Almaty Higher Medical College. Today we'll talk about first aid. In this presentation, I used videos taken from St. John Ambulance YouTube channel. These simple first aid steps can help you to take care of someone after an injury. The objectives of the presentation are to use the unit vocabulary through speech exercises, to practice speaking, listening, reading, and writing skills on the theme first aid, and to teach students how to give first aid. We'll talk about how to give first aid in different emergency situations, for example, shock, fracture, fainting, burns and scalds, and how to give CPR. CPR means cardiopulmonary resuscitation. Everybody must know how to give the first aid. The first aid saves many lives. First aid is the help which you give to an injured person. Some knowledge of first aid is essential for everyone and should be an essential part of teaching at the medical college. But remember, only someone who knows first aid well should try to treat an injured or sick person. Usually, you give first aid until a doctor or an ambulance arrives. Never try to give someone first aid unless you know what to do. The wrong actions can do more harm than good. There are some rules of giving first aid. You shouldn't waste time asking unnecessary questions, should act without panic, and shouldn't lose your head. What is shock? Shock is a critical condition brought on by the sudden drop in blood flow through the body. Shock may result from trauma, heat stroke, blood loss, an allergic reaction, severe infection, poisoning, severe burns, or other causes. When a person is in shock, his or her organs aren't getting enough blood or oxygen. If untreated, this can lead to permanent organ damage or even death. Signs and symptoms of shock vary depending on circumstances and may include cool, clammy skin, rapid pulse, rapid breathing, nausea or vomiting, enlarged pupils, weakness or fatigue, dizziness or fainting, changes in mental status or behavior such as anxiousness or agitation. In this video, we can watch how to give first aid in shock. A St. John ambulance trainer demonstrates what to do if you suspect someone is suffering from shock.
Help the casualty to lie down. If possible, try to lie them down on a rug or blanket, as this will help protect them from the cold. Raise and support their legs above the level of their heart, as this will increase blood flow to the head and vital organs. But if the casualty has an injured leg, do not raise it. If the casualty is pregnant, help them to lie with their body leaning towards their left side to prevent obstruction of blood flow returning to the heart. If you haven't done so already, call 999 or 112 and tell ambulance control that you suspect shock. Once you have called for emergency help, you can then loosen any tight clothing around their neck, chest and waist. Stay with the casualty and keep them warm by covering them with a blanket or coats. Try to reassure them and keep them calm. Keep monitoring their level of response. If they become unresponsive, open their airway, check their breathing and prepare to treat someone who is unresponsive. So remember, if you think someone is in shock, treat the cause of shock. Lay them down and raise their legs. Call 999 or 112 for emergency help. Loosen any tight clothing and keep them warm and calm. Monitor their level of response. And that's how we treat shock.
A break or crack in a bone is called a fracture. The causes of fracture are traumatic incidents, sporting injuries, vehicle accidents, falls. And the signs and symptoms of fracture are pain at or near the site of the injury, difficult or impossible to move normally, loss of power, deformity or abnormal mobility, tenderness, swelling, discoloration, and bruising. In this video, St. John ambulance trainer demonstrates how to treat a fracture.
If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling.
Fainting is when someone briefly becomes unresponsive, often causing the person to fall to the ground. It happens because for a moment there isn't enough blood flowing to the brain. Fainting can be triggered by a number of factors, including fear or other emotional trauma, severe pain, a sudden drop in blood pressure, low blood sugar due to diabetes, dehydration, standing in one position for too long, standing up too quickly, physical exertion in hot temperatures. Losing consciousness is the primary symptom of fainting, and the following symptoms may occur leading up to a fainting episode: a feeling of heaviness in the legs, blurred or tunnel vision, confusion, feeling warm or hot, lightheadedness, dizziness, or a floating feeling, nausea, sweating, vomiting, and yawning. In this video, a St. John ambulance trainer shares how to identify signs of fainting and demonstrates what to do if someone has fainted.
If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty.
Burns and scalds are damage to the skin caused by heat. A burn is usually caused by dry heat, like fire, a hot iron, or sunshine. A scald is caused by wet heat, like steam or a hot cup of tea. Symptoms of burns and scalds are like red skin, peeling skin, blisters, swelling, white or charred skin, and pain. In this video, a St. John ambulance trainer demonstrates what to do if someone has suffered from a burn or scald.
If someone has a burn or scald, move them away from the source of the heat to stop the burn getting any worse. Then start cooling the burn as quickly as possible. Place it under cool running water for at least 10 minutes or until the pain feels better. Don't use ice, gels or creams, as this could damage the tissue and increase the risk of infection. If the burn looks like a serious burn or it's to a child, it's larger than the size of the casualty's hand, it's a burn to their face, hands or feet, or if it's a deep burn, then call 999 or 112 for emergency help.
CPR, or cardiopulmonary resuscitation, is an emergency life-saving procedure performed when heart stops beating. If an adult is unresponsive and not breathing, you will need to do CPR. There are two types of CPR. The first is chest compression and the next is rescue breath. In this video, St. John ambulance trainer takes you through CPR steps and demonstrates how to perform CPR on an adult.
You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand centered on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive." After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths.
In conclusion, I'd like to say that I hope you've acquired knowledge of giving first aid. And you know, the most important thing is applying the appropriate techniques of first aid while waiting for professional medical help. We can save many lives and we can considerably reduce deaths and injuries. And to sum up our lesson, I prepared some tasks for you. Let's do some tasks. Task number 1. Give your opinion, discuss with your partner. The question is, giving first aid, what can we prevent? Task number 2. I have told about some rules of first aid. And do you have anything to add? Task number 3. Define the meaning of the given words, match the words and word combinations. You can find some assignments in the platform below.